Hello, I'm Dr. Shagufta. What causes dark urine is the question of today's video. As we all know, urine is nothing but excess water and waste products which our kidneys filter from the blood. It can range from pale yellow to dark amber depending on the ratio of water to waste products. Many things can affect the color of the urine. Most of these are harmless, but sometimes a change in color of the urine can signal a bad health. Let's discuss 5 most common reasons to give you dark urine and what are the treatment options available for that.
The first one could be a dehydration. Dark urine is usually a sign of dehydration. As you all know, dehydration occurs when there is not enough water in the body. In most cases, patients can treat dehydration by drinking more clear fluids such as water, fresh fruit juices, and herbal teas. Some of the dehydration symptoms are lethargy, that is, feeling tired all the time, having very dry mouth and tongue, or having the skin that moves back very slowly after being pinched, and having a weak or absent pulse. I'm going to make a detailed video later on a pulse checking, how to know if your pulse rate is normal or it's absent or weak. And the other symptom of dehydration is having very low blood pressure or having minimal to no urine. People should seek medical advice if they have any or all of these symptoms. The treatment option usually is just drinking a lot of water and fresh fruit juices, but in case of severe dehydration, administering oral rehydration salts or fluids or electrolytes in the hospital is the option left with us. The second reason for dark urine could be because of some food or drink or medications. Some foods and drinks can cause a change in the color or also can cause some change in the smell of the urine. Some medications such as senna, chlorpromazine, warfarin, amitriptyline, indomethacin, cimetidine, iron and multivitamins, etc. These medications can cause changes in the color of the urine. Treatment option for dark colored urine due to food, drinks, or medications is not usually a concern. There is nothing much to worry about it because the urine will return to its normal once the patient stops consuming whatever is actually causing the change. The third cause is hemolytic anemia. Red blood cells develop in the bone marrow. The body usually destroys the old or faulty red blood cells in the spleen in a process called hemolysis. When the body mistakenly destroys too many red blood cells, a person might develop hemolytic anemia. Other causes for hemolytic anemia is genetic blood disorders such as sickle cell disease or thalassemia. Now, the treatment option for many mild cases of hemolytic anemia do not require any treatment, but for others, like lifestyle changes, can actually help control the symptoms. But in case of severe hemolytic anemia, mostly we need blood transfusions, blood and bone marrow transplants, or surgery to remove the spleen may be needed. Now, the fourth reason for dark urine could be urinary tract infection. This happens when the bacteria gets into the bladder, usually through the urethra. Women tend to develop UTIs more often than men. And the treatment options is your doctor will usually prescribe a short course of antibiotics to treat UTIs. People with a severe infection may require a longer course of antibiotics. Antibiotics is the only option for urinary tract infections, and also keeping the area clean and drinking good amount of water. Now, the fifth cause for dark urine could be hepatitis C. Hepatitis C virus or HCV can cause an infection of the liver. It has very few symptoms during the early stages, so not many people would know about it until the liver damage may start causing until the liver damage will actually start giving you problems. The treatment option is any person who suspects an exposure to hepatitis C virus should seek immediate medical advice. The virus can lead to severe liver damage if it is left untreated. As we all know, HCV exposure could be due to sharing needles, having unprotected sex with a person who has HCV already, and receiving tattoos using unsterile equipments. So that's it about the 5 most common causes which can cause dark urine, and some cases you don't have to worry at all as they are harmless, but in some cases you need to actually seek medical attention immediately. I try to keep my videos very small and brief so that all the explanation is given, and in case you find you need some more details on any of the issues or any medical problems, please do leave a comment in the comment box or a message so that I make a video on that disease or the problem. That's it for this video. Take care.